Hey, fearless friends, it's Amy Schmidt, and I am so happy to be on with you today and bringing you a great episode. Before we get started, I want to remind you to go ahead and follow along at all the socials. You can go to theamy.schmidt on Instagram, Fearlessly Facing 50 over on Facebook, and follow along at LinkedIn. If any of you are into LinkedIn, that's one of my goals for 2025. I also wanted to let you know that those Tell Me Something Good jars, I talk about them often. You know how we as women, we deflect those compliments. Yep. Get yourself a jar. You can pop in any compliment you get. You write it down, you pop it in the jar, you pull it out on one of those days, and wow, you know how much value and love you add to others. So check them out. You can contact me over at theamy.schmidt on Instagram or Fearlessly Facing 50, or follow along at fearlesslyfacing50.com. 50 is spelled out, and you can get yourself one of those Tell Me Something Good jars. Well, today's guest, I have on someone I truly admire for many reasons, but I'll tell you what, our heart health as women, as we age, is so important. Today, I have on with me Dr. Jayne Morgan. She is a cardiologist. She is the head of so many different organizations geared towards women's health and how we can advocate for ourselves. So sit back, relax, and get out your pens and pencils for this one or your notes in your phone, because there are some fabulous tips to be better about our heart health in 2025. Stay tuned. Hey, fearless friends. Well, it's Amy Schmidt, and I am excited to be back on with this incredible guest. You could hear in the intro, Dr. Jayne Morgan, but I'm going to call her Dr. Jayne, is just incredible. And I have to tell you that I have followed you for so long.
Oh, thank you. Oh, my goodness.
I have. I have a son who lives in Atlanta, too, in Buckhead. I have a husband who, and I made this very public last year when I went on hiatus from the show. I had a husband at 55 who had a heart attack.
Oh, my goodness.
Yeah. So I've been kind of living this heart thing for a while as a spouse. And, it was really interesting because we're going to talk today about women's health, and we're going to talk about, heart disease is actually the number one killer of women, and it doubles at menopause, which is amazing to me.
And we have
my husband, picture of health. I mean, there were no blood pressure issues. There were no cardiovascular, lipid problem, all of that stuff. Some family genetics. So we might have to talk about that a little bit today. But anyway, I am very much an advocate for heart health. And I think that, we are a generation of women right now that are very focused on menopause, which is fabulous. I'm so glad that there is a light, bright light being shown on that. But heart disease goes right along with this.
That's right.
And is so important. Yeah. So let's talk about that a little bit. Just give us some down and dirty facts here about heart disease for the women that are listening and watching right now, and what we need to do.
All right. Some down and dirty facts.
Yep.
If you have pregnancies that are complicated by anything like high blood pressure or something called gestational diabetes or preeclampsia, this increases your risk of heart disease, not only during your pregnancy, but throughout your lifetime. In fact, it doubles your risk of heart disease. So what should happen as a high-risk OB patient, which is what you surely would have been, is that a cardiologist should have been inserted into that team. That generally does not happen. So the next thing then that should have happened after your baby is born safely is that there should have been a warm handoff to a cardiologist where you can get a consultation and be able to have that relationship for life, because if you developed any of these conditions during your pregnancy, from a cardiologist perspective, we consider that to be a failed stress test, because pregnancy is a volume overload state. And if you're not able to manage that overload, you're failing your stress test. So think about that as far as a failed stress test. And then now let's move into perimenopause and menopause, where we also have an increased risk of heart disease. 84 symptoms of perimenopause. Most people, they think about perimenopause and menopause, it's all about hot flashes and night sweats. Right. It's not. There are 84 symptoms: itchy ears, metallic taste in the mouth, change in deodorants and odor of the body, and all kinds of things can happen. Vertigo, which is a type of dizziness, palpitations, any number of symptoms. Guess what, ladies? That's perimenopause, and it's being driven by your estrogen levels dropping. And because those estrogen levels are starting to drop, That's what increases your risk of heart disease because estrogen protects your heart. It's a cardioprotectant, a direct protective agent on the heart because it binds directly to estrogen receptors on the heart, but also it's an anti-inflammatory agent.
Oh,
We have
we hear that
natural
that's a buzzword.
anti-inflammatory hormones. And
Yep.
inflammation is one of the risk factors for heart disease. So there's just a few down and dirty from fertility all the way through menopause. Here are the things we need to be thinking about to protect our hearts.
Isn't that crazy? I think it's really interesting because, we advocate for everybody else, right? We do.
Right.
I mean, we do. We're
We
everything to
do.
everyone, a lot of that. And we hear that a lot. It's very difficult for us to look in the mirror and say, wow, I don't know. I don't need to go to the doctor. This little feeling I'm having, it's nothing. It's nothing. I'm going to wait it out. It's probably stress. I mean, how many times do we do that? We put ourselves on the back burner and we don't get the attention or advocate for ourselves around our health.
Now, in defense of us, in defense of women, I will say this. We also are not taught what the symptoms of heart disease or heart attack may look like in women. And because we're not taught it, we really can't fault ourselves too much for not recognizing them. And also, our symptoms, just to make it fun, can often be um, um, symptoms of other types of diseases as well. So, who doesn't have back pain? Who doesn't feel tired? Who's not fatigued? Even if you have jaw pain, that might be something that sends you to the dentist.
Right.
So our symptoms also can be more subtle, not this crushing chest pain and shortness of breath,
Right.
and can be attributed to other things. We're raising kids. We have busy careers. We've got husbands. We have aging parents. Who's not tired? Who doesn't feel fatigued? Who doesn't feel run down? And yet those can be some of the symptoms of an early heart attack in women. And one of the reasons that heart attacks in women, the first heart attack is more often fatal than those of men, is because of that delay in care.
Wow.
We delay.
Did you hear
in
that,
seeking
ladies that
care.
are listening
We
right
don't
now? Yeah,
recognize
it's
it.
the delay.
Right. There's a delay because we don't recognize it and it goes on and on and on for days and days. And also, unfortunately, when we reach the medical establishment may also minimize your symptoms, give you a term called atypical chest pain, that term atypical, which really then drives action or drives inaction. And really, I've been working hard to remove that from our entire lexicon. That's the actual language that doctors use to speak with each other. This 32-year-old female with atypical chest pain, that's standard language where we're communicating. But what are we really communicating? We're communicating that it's probably not chest pain. She's got some symptoms that are concerning, but probably not. We're going to call this atypical. Whereas you don't call a man's symptoms atypical. Therefore, he more directly goes to the cath lab and gets that life-saving intervening stent. And a woman is kind of relegated to maybe antidepressants. Let's watch her for 24 hours. Maybe it's due to stress, that type of thing. And then what happens? That first heart attack is more often fatal. That's where those statistics come in. And women, remember, we're the majority of the population. We're almost 52% of the population. So here's how the patriarchy drives that. We're the majority of the population. How did we end up with the atypical symptoms?
Right.
We ended up with the atypical symptoms because the patriarchy drives what's important and what's not important in medicine, what we should learn and what we should not learn. And so we've been relegated to the back burner under a term of atypical, when in fact we're the majority of the population. So
wow. I wonder how many of us listening and watching right now, how many people have had that atypical chest pain.
Right.
So I want to talk about something because I think this is something really interesting. I do a lot of, I do a lot of discussions just with dear friends of mine about heart health. But one thing that comes up a lot is blood pressure. And I want to talk about this because I have a few people in my circle that have had some, blood pressure that's a little bit higher. And they've come back and they've said, "No, I don't want to take any medicine. I don't want to do it. I'm gonna fix this myself with exercise and diet." And I think blood pressure is a big issue, right? For women, we a lot of us are walking around with high blood pressure and don't even know it, or we're trying to fix it when we might need some medicine.
Right. And you know what? As you go through midlife and perimenopause and menopause, ladies, unfortunately, it's harder and harder to fix things with weight loss. Why? Because it's harder and harder and harder to lose weight. We develop this visceral fat because of our hormone levels dropping, visceral fat around the midsection. And it's a special type of fat. This type of fat is metabolically active. And so not only do you see it outwardly in your belly, it's also encasing the organs inside of your body. And so we want to work to keep that down as much as possible. But unfortunately, we see weight gain during this period of time. And
Right.
so if you think that you're going to lose weight, and I'm not discouraging you, I'm just saying that it becomes harder and harder and harder. And so my recommendation, not to discourage you from losing weight, we absolutely want to lose weight and have a better diet, and it certainly can be done, and we can accomplish it. It becomes more challenging. However, during that entire time where you're working on it, your blood pressure is still high. So let's treat your blood pressure. And as you become increasingly successful in losing weight, we can start to come down on those medications because guess what? There's a reason that hypertension is called the silent killer.
Yeah.
You don't
Yep.
feel anything until it strikes and you have that stroke and you have a heart attack. And literally, I work for a remote blood pressure monitoring company to decrease your risk of heart disease. It's called Hello Heart. So you can monitor your blood pressure 24 hours a day, connected to an app. Gamification encourages you, knows what medications you're taking. You can input your cholesterol. All of this is to drive women, especially, to take better care of ourselves because generally we look in the mirror and put ourselves last. So at Hello Heart, we are trying to put you first for that very reason. I don't want to take medicines. And here's what happens in our psyche. We equate taking medications with being sick or with not being as healthy as our neighbor. When in fact, if we don't take the medications, that's when we are actually not as healthy as your neighbor. My preference for me is I would rather take a medication and have normal blood pressure than be able to brag that I'm taking no medications and my blood pressure is elevated.
Exactly. But I think there's a lot of women out there that really struggle with that. They really do.
Right.
And
We do, and we struggle with aging. I mean,
yeah,
aging is such a stigma for women in this country, and then taking medications and having medical diagnoses
right.
is an admission of getting older. We don't want to admit that because society frowns upon it, and that's what this whole conversation is about.
Yep.
Life is not over at 50. We're really just beginning. We're
Yeah.
really just moving forward. And so let's begin to take care of ourselves, shrug off all of this nonsense of you have nothing left to contribute after you're 50, after you're 55. Oh my
Exactly.
gosh, your best is yet to come. Your best thinking, your best
Right.
contributions, more freedom from all of the responsibilities that you have. And that also means taking care of yourself, and don't marry yourself to not taking medications because you're afraid that you are aging.
I love that. Thank you for saying
You're
that.
going
I
to
think
age.
that's an
Yes.
important
Yes.
message. Let's
Right.
talk GLP-1s for a minute because
Okay.
a lot of people are on them. A lot of people are
Yeah.
working hard to lose weight, establishing new habits,
Right.
all of that. Here's a concern
Yes.
that I hear from time to time from people. GLP-1s and muscle mass. You're losing muscle.
hmm
Now, I don't know. I'm obviously not a physician and I don't know all of the medical terminology around it, but heart is a muscle, right?
Yeah. The heart is a muscle. So heart is striated muscle, which is a type of skeletal muscle that is exactly the same kind of muscles we have in our legs and in our arms, which is one of the reasons why myself and other cardiologists are proponents of exercise, especially in women, even if you don't lose weight. The point is to move and to also get that exercise
Yeah.
in your heart muscle, which is the same muscle as your legs and arms. Men generally exercise for endorphins. They like it. It makes them feel good. Women view it more as a task. We do it for vanity. We want to lose weight. We want to fit in our dress.
Right.
And actually, and but we actually should be doing it more to actually take care of ourselves. And even if that weight isn't coming off or is not coming off as quickly as we like, to know that we actually are healthier
Yeah.
because we are working our hearts. So even if you don't see it physically, externally, internally, your organs are seeing it.
Yeah.
And that's the point. And that's hard to measure when we don't get that external reflection and
Exactly.
that external validation. And you go, oh my gosh, I've gone to the gym, I've done these walks, I've done this for 6 months, and I look exactly the same.
Yep.
And guess what? But your heart is stronger. You're increasing longevity. Let's
Love
talk
that.
about healthy aging. Let's talk about what longevity really looks like. That's what it looks like. You might not be losing weight, but your heart
Your heart.
is nice and strong. And so
So
look at it
important.
that way as well. And I don't want to say, I'm not trying to discourage people from losing weight. That's twice I've talked about weight and made it seem as if maybe it's not important. It is important. We definitely want to keep our weight down because that decreases chronic inflammation in our body.
Yep.
That also accelerates heart disease. But I also want to add for you to not quit exercising if you're not reaching your weight goals,
Right.
because your heart goals are being met.
Yeah. Yeah.
So do
That's huge.
Yeah.
So for somebody listening or watching today and is hearing you, and I just love your passion and your knowledge around this, somebody listening and they're sitting on the couch and
Right.
they're frustrated and maybe
Right.
they've gained weight. Maybe they're, postmenopausal now. Maybe they're stuck.
Right.
Give me 3 things that they can do today that they can start advocating for their heart health, getting moving. What can they do?
Okay. One thing. Next time you go for your annual physical exam, and I'm not saying rush out and make an appointment, I'm just saying your next annual physical for women, I want you to ask for an EKG to be done. Men always get EKGs done, or much more frequently during their physical exams, but women don't. Why? Because for women's health is always focused on the reproductive system. Breast exams and mammograms and pelvic exams and pap smears, and all of that is important. But somehow we forget that women have hearts and brains and lungs and livers, and we don't ever look at any of the rest of it. So, as a cardiologist, I want you to get an EKG, not because I think you're sick. I want you to get an EKG such that it is a part of your permanent medical record, so that if anything were to happen later, like you present to the hospital with those vague symptoms and people are minimizing it and turning you away, they have something to compare when you were healthy, that baseline EKG.
Fabulous.
2, whenever you go to the hospital, if you are feeling as if you are being dismissed and you're concerned about your heart, but you're having trouble advocating for yourself and the doctor is saying no and the nurses are running around, one thing I want you to ask for before you leave that hospital or that doctor's office, say, hey, doc, would you mind doing an EKG? The answer to that is always going to be yes, if the patient requests it. And that will stop them in their tracks. And that is a way to advocate for yourself without having to pull out articles and quote people and argue with the doctor or
Right.
challenge the doctor if you don't, because as women, we don't feel comfortable challenging the establishment. So don't do any of that. If you feel as if your needs aren't being met, say, hey, would you mind doing an EKG before I leave?
Perfect.
And then that EKG, if it is abnormal, therefore drives the rest of what's
Yeah.
going to happen. And you didn't have to advocate for yourself. And then the third thing is to just move. I know the American Heart Association says, 30 minutes of exercise to moderate intensity. And if it's high intensity, you can do it for 3 days a week. But it just starts to get so complicated. Actually, when you read it, it's pretty simple. But when you try to recall it, nobody can remember exactly how it worked. Was that high intensity? Was it moderate intensity? What is this? Is swimming low or is it medium? And what happens when humans get confused? We just become inert. We don't do anything.
We don't do anything.
So
Yeah.
here's what I say as a cardiologist. American Heart Association is not sanctioning this, but here's what I'm going to tell you. Pick an activity that you like. I don't care what it is. Whatever you like to do. You like to crawl around on your knees out in the yard for an hour, whatever it is you like. Do that activity for 20 to 30 minutes a day, 5 days a week. If you are a woman over the age of 50, add some resistance twice a week. Whatever resistance means to you. It doesn't have to be, I like resistance bands and things like that in Pilates, but it doesn't have to be formal. You can get a weighted vest and walk. It doesn't even have to be that formal. If you work in the yard, carry the bags of mulch back and forth, move the rocks around, stand up and down, lifting the things. Add some resistance to what you're doing in your activity. Let's not make it complicated. Pick something that you like to do, something that you would do anyway, something that you want to, that you enjoy, and just do it. Then figure out how you add some resistance to it. For instance, even in the house, maybe you pick up the heavy jugs of milk a few times for 10 minutes and take them in and out of the refrigerator.
Exactly.
Make it easy for yourself.
Yes.
Don't get a gym membership and try to figure it out.
Right.
Just pick up the gallon of milk in your refrigerator and take it in and out of your refrigerator with each arm 10 times. Let's make it easy.
I love that.
And close the refrigerator door.
I love that. We're winding down to the end here because I know you've got a hard stop and I do too. But you know what's something I really want to get out there today, and so many great tips, is what is something that women should be aware of? There's different symptoms. I said my husband had a heart attack. I wouldn't say it was textbook as far as symptoms for him. For women, I know they're different symptoms. Is there something that really is one of those things or three things that we really should be aware of if we're worried about a stroke or a heart attack? Are there symptoms that are aligned with everyone?
Right. And so, those are the kinds of symptoms. Obviously, everybody knows if you get, one side of your face drooping and you're having difficulty moving, but there can be more subtle symptoms as well. You're having difficulty remembering things. You're kind of spacing out. We call it spacing out for periods of time. You're not really sure where you are. Those are all types of symptoms that can be worrisome. And the other thing that I want to add, especially for women, is to get your flu shot, because the flu shots decrease your risk of heart disease. Why is that? Because flu shots decrease your risk of contracting the flu. If you were to get the flu, this is a huge inflammatory response in your body. And that inflammation further drives heart disease, especially if you already have heart disease. So a simple thing to do to protect yourself as well is get the flu shot. Just those little secrets, those little things that can just kind of keep you moving through life in a healthy way. Again, something you can easily do at your doctor's office when you're asking for that EKG. Just walk in, I need an EKG, I need a flu shot. Now, doctor, what is it that you want to say? I need to get those two things out of the way.
You just armed us with some great tools right now to advocate for ourselves, to be our healthiest self, and live our best lives. I mean, it's not stopping at 50. That's for sure.
It's just starting.
It's just
and
starting.
The only thing better than 50, ladies, if you take care of yourselves, is 60.
Yes, exactly. I'm getting close, so I love it. Thank you, Dr. Jayne. I appreciate it. I look forward to having you back on. Thanks so much for listening today. We know how valuable your time is, and that's why we keep it short and sweet. Don't forget to follow us on all the socials, and you can check out all the links and resources in the show notes. Until next time, go forth and be awesome.